Life is about to get weird.
My name is Dr. David Toll. My life's goal is to help people with OCD get rid of their compulsions. I've invited 6 patients, all with different kinds of OCD, to join me for 21 days of intensive treatment.
I will wash my hands so much that the skin on my hands completely peels off.
Kind of just started touching everything. The anxiety increased, frustration increased.
I have a fear of hitting pedestrians.
Words go through my head. My biggest fear is harming somebody.
I fear for my son's health, always afraid he's going to get cancer. A lot of what I do is to keep my son alive.
You know, what if I have some spell happen, you know, that a plane crashes or an earthquake? See, it can ruin your life.
Hi. Are you Jerry?
I'm Jerry.
Is there only one bathroom in this house?
This is a sick, sick joke. I want to go home.
I'm Dr. David Tolan. We're going to be facing our fears. It's going to be unpleasant. The battle with OCD begins tomorrow. When a person has OCD, they've lost control of their behavior. They want to stop, but they don't know how. Rituals happen. The first couple days cut them a lot of slack. They're just getting used to this, getting their feet wet, getting a sense of how things are going to go. That's going to have to change pretty soon. Hey, Cody, how are you?
I'm good.
Have a seat. This morning, I want to meet one-on-one with each of the patients to learn about their specific fears. A person with OCD doesn't look sick. You might be sitting next to one of them on the bus. You don't even know it. But that person is living in fear, trapped in a cycle of behavior that they can't get out of.
I'm kind of like a perfectionist in a way, in a bad way. Like, I don't want to, have any deformities or anything on me, or, if I sit weird, I gotta sit up and straighten it all out and make sure my skin doesn't mold in a different way. So I do this with my nose. I'll one on each side of the nose to keep my nose straight. And I do it 5 times, 2 sets of 5. I do this thing with my hair over my ears to keep my ears, not like Dumbo ears.
Because the concern is if your body's just going to start growing in weird directions?
Yeah, just like get out of control. And I couldn't get out of bed because I'm tossing and I'm rolling back and forth, left to center to right to center before I will get out of bed.
What are you trying to accomplish with that?
I don't really know. I just kind of want to be even, like...
Trying to get a sense of evenness.
Yeah.
Cody's OCD primarily involves repeating. Lots of people with OCD worry that they're going to make a mistake. The solution for them is to keep doing rituals, to keep doing compulsions, to go back and check, to undo it in some way, and they get trapped.
And I probably shouldn't tell you, but you know what? We're throwing it all out here, and here's where, I've never told any doctor about this or anything. I was at somebody's house, and we were watching a scary movie, and some guy was going around killing people, I guess. And he had put this plastic bag over this person, and you can see the fear in the eyes and everything, and they're shaking, and I got a panic attack, and that was like, oh my God, what if I ever do that? That's just crazy.
Well, you got to face it.
Well, you don't want to go around telling people that you have a fear of hurting people.
You think about it because you're afraid of the idea. The reason that it keeps coming up in your mind is precisely because it's the last thing in the world you would want to do. Sometimes traumatic events can play a role in the onset of OCD symptoms, and it's important for me to find out what those triggers may have been. Have you had experiences in your life that may have set up potential for a problem?
I was sexually molested at age maybe 4, 5, or 6.
Oh my goodness.
I got beat a lot. I got the crap beat out of me quite often. I just want to be happy. I don't care if I live in a cardboard box. If I'm happy, then I'm happy.
Imagine living in constant fear every minute of every day. Imagine that the weight of the world feels like it's on your shoulders, and your every move could kill you, could cause harm to your loved ones. And the only way you can cope with that fear is to engage in these repetitive behaviors.
I do remember flipping light switches when I was 13, and that was very shortly after I was sexually abused.
May I ask who abused you?
A couple people.
People you were close to?
Uh-huh.
What is the contaminant for you?
A lot of my fear comes from men's bathroom habits.
Because they handle their privates when they go in the
Yes.
bathroom? Is that what it is?
Yeah.
When a man goes into a bathroom, the issue is that he is putting his hand on his sweaty, gross genitals.
Yeah.
And the nasty, gross genital sweat
Yeah.
is then going to be transferred over to whatever he touches and potentially get onto you and make you dirty and foul.
And smelly.
And smell. Sometimes we find traumatic events that do seem to have teed them up to develop OCD, but that doesn't necessarily dictate what their life is going to look like. That's where the trick is with the treatment. Renee, could you tell me how the events with your dad play into the development of the OCD?
Well, I don't know if you know, my dad was killed in a car accident. Yeah, so he was a pedestrian.
Your father was hit by a car.
Yeah, all of this whole disorder is so connected to losing my dad.
RNA's main fear is that she's going to run people over with her car. But she's also afraid of contamination, particularly blood.
It started when I was a freshman in college. You know, I took 2-hour showers and I walked around a lot like this because I just didn't want to touch anything. You know, I was studying with latex gloves on because I didn't like the used books that I had.
Just to read a book.
Just to turn the pages.
Because somebody else has touched those pages.
And because there were like pinkish, reddish spots sometimes. If there was any kind of inkling that there could be blood on there, like something that looked like blood to me, I didn't want to use it.
Can you envision life without OCD?
I want to get rid of it, don't get me wrong, but it scares me not to have it.
In what way?
Because I'm going to lose every bit of control that I have. I'm not going to be able to save anybody.
But you've got this idea that your rituals
1, 2, 3, 4.
are benefiting other people.
Yes.
And I guess what we're doing is we're not going to give up control, but what we are going to give up is this warped illusion of control. The idea that life and death hinges on how you turn on and off the light switch or what you do with a sink. Do you have any worries that when we start doing exposure therapy, any worries that we're going to
What?
kill your family?
I'm going to get a phone call. Most likely.
And it would be your fault?
Yes. Because the minute I stop, I'm going to get that god-awful phone call.
A lot of people use the word control when they're describing their OCD. I do these rituals. I wash my hands. I arrange things. I repeat my behaviors because it makes me feel like I'm in control. If we step back from that and really look at the person's life, they've lost control.
It's a bug. Do you see? Is this a trick or something?
Do you think it's a trick?
No, what is...
It looks like a bug. Do you think that we would have planted a bug in your bed?
Okay, I mean, this is a very professional show, right?
Right.
So there shouldn't be like bed bugs in the bed and stuff, right? Would you mind chaperoning the bug and I'm gonna go get a cup from downstairs, yes?
Do you want me to stay here and watch it?
Is that okay?
There's a what in your bed?
A bug. I'm gonna show Dr. Toll in it because I don't know if it's like a bed bug. They call me the bug whisperer, you know what? Whoa.
Hey, Kevin, how are you?
Oh, just wonderful.
Good to see you. How you been?
Hi, okay.
Here, have a seat.
I wanted to bring something up real quick.
Yeah, what do you have there?
You know, I was sleeping, and you know, I was making my. I don't even make my bed. I was just kind of like fixing my pillows, and so there was like this bug. Now, you know, I don't mind bugs at all.
Yeah.
And I used to like play with them as a kid. But like if they're bed bugs, that's not good.
Okay.
So here is the critter. Is that a bed bug or not? Should I be worried? Or should I just put him outside and be done with it? I don't know. I also kind of wanted to show you. I didn't want like, well, you know, are you sure it was a bug, you know, or was it a black dot? You know, I want to make sure that you know that I'm not making this up.
So I get that you had a bug in your bed.
Is that a bed bug or no? That's the main question.
Now, Kevin, you understand I'm a psychologist, not an entomologist.
I don't know.
I think of all of these patients, Kevin might be the toughest one to treat.
If there should be any other problems, you know, then like I would have, you know, reasonable reason for concern.
Right.
All right?
If Kevin's gonna get the most out of this therapy, I need him to focus on the task at hand. Instead, he's paranoid that we're planting bugs in his bed. I suspect he's got a lot more going on than OCD.
Time will tell.
Coming up.
It's just a signal in your brain.
I need to call my son.
And later.
May I have your shoe, please?
Okay.
We have some problems.
All right, guys.